Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could return for another segment. We'll be speaking with Dr. Harvey Kaufman. He's joining us here as Senior Medical Director of Medical Informatics at Quest Diagnostics to talk about lagging cancer diagnoses and why these lagging cancer diagnoses pose a threat to the progress made in cancer-related deaths. Welcome to Health Professional Radio, Dr. Harvey Kaufman. Thank you.
Thank you, Neil.
Tell us a bit about yourself and your role at Quest Diagnostics.
I've been a employee of Quest Diagnostics for 30 years in a variety of roles. I was the first Chief Laboratory Officer and the first Six Sigma Quality Leader, and I'm proud to have been involved and lead the Quest Diagnostics Health Trends research team.
Now, when it comes to cancer diagnoses, lagging cancer diagnoses, are all of the diagnoses across the board lagging well below pre-pandemic levels?
The likelihood is yes. So in this study, we looked at 1.1 million patient records. These are all de-identified cancer diagnostics test results over a little over a 3-year period. We started in January of 2019 to get a pre-pandemic view, and we extended through March of 2022. We looked at 8 different cancer types. And we found that in the early months of the pandemic, we're talking, let's see, March, April, May of 2020, when a lot of healthcare was frozen except for COVID-19 care, that there was a 30% decline in patients who were newly identified in our database with cancer. That's expected given that frozen nature of healthcare outside of COVID-19. Mm-hmm. And then we looked at the next 10 months, and it was down 15%. And we understand that there were waves of COVID-19 and there was hesitancy to re-engage. But then we added one more year. So we looked at April of 21 through March of 2022. And sure enough, there's still an 11% decline in patients who are newly identified with cancer relative to the pre-pandemic levels.
Other than obviously the fear of the pandemic or the fear of contracting COVID, taking it home to your family, what is driving this continued reluctance?
For things like colorectal cancer, there are tests known as fecal immunochemical tests and other tests to screen for risk for colorectal cancer that can be done at home or performed at home and sent by mail or otherwise dropped off for testing. So there's a hesitancy of patients to return, and there's also a supply issue in terms of there are fewer doctors because doctors and nurses and others have retired and stepped away from their practices. So there's a shortage of supply and there's strong demand. And sometimes it's one or the other that's leading to this decline in patients newly identified with cancer.
Well, it seems to me that part of the problem could be an apprehension to return to the medical community out of fear and maybe possibly distrust based on what happened, surrounding the pandemic. Doctors have been retiring. Students have been becoming new doctors continuously for decades and decades. But the pandemic, even though it stopped everything, it seems that things should have started back up and we should have returned to some type of normal, at least as far as hiring, supplies, people retiring and being replaced, but that hasn't happened.
It hasn't happened to our detriment in terms of our health. If you look at what we've done for cancer in the past 3 decades, it's one of the great stories in healthcare that there's been approximately 1% improvement every year in terms of lowering the death rate from cancer. The American Association for Cancer Research looked at the period 1991 through 2019 before the pandemic, and there was a 32% decline in cancer deaths. According to the American Cancer Society, it's even more so with breast cancer, a 43% decline, saving nearly 500,000 women from breast cancer deaths. And this remarkable achievement in healthcare, slow and steady, is now at risk, according to this study. because patients are now going to present, or at least many patients, at more advanced stages. They'll require more aggressive therapy, and they'll have worse outcomes.
So basically, it's going to tax the system in a more profound way than it was taxed prior to the pandemic when it comes to diagnosing and treating cancer in its earlier stages, if I'm hearing you correctly.
Absolutely. And we're going to be taxing hospitals and health systems that are already stressed in terms of their financials, in terms of their staffing. And if we look at the acuity, which is how sick patients are, it's increased approximately 10-11% compared to pre-pandemic levels. If we look at the breast cancer case mix, it's up 11% in 2022 versus pre-pandemic. Prostate cancer length of stay has gone up about 16%. So hospitals, health systems are really hit hard by the pandemic in terms of workforce shortages, burnout, supply chain constraints, lower operating margins are now going to be hit again.
Now, this decline and this lack is still in spite of the fact that we're inundated with information, ads, flyers about at least breast and prostate cancer, among many others. But the decline still persists.
It does. And we look specifically at 8 different types of cancer for prostate and breast cancer, which are the most common types of cancer among men and women, and the second leading cause of cancer deaths for each sex. They remain significantly below the pre-pandemic levels. For prostate cancer, was down 17%, and for breast cancer was down 11%. So despite all these reminders, they're not enough to get people back into the routine of going to their doctor, making these appointments to the clinic, to the hospital. And remember that at the early stages, many cancers don't have symptoms. And for many health conditions, whether it's blood pressure or diabetes or chronic kidney disease, at the early stages, there aren't symptoms. And that's why testing and diagnostics is so important for our health.
Talk about some of the efforts that Quest Diagnostics is involved in to continue diagnosing cancers and what they're doing to try and combat this lag, this apprehension.
We're encouraging people to do what's right for their own health. The American Cancer Society has a great website, cancer.org, that provides more information where people can look up to find out what screenings are appropriate for them. Despite our concern and mistrust of a lot of entities in the United States today, and we do trust our doctors, and our doctors are trusted sources of information. We encourage people to talk to their doctor. Quest Diagnostics offers a free quiz for people that can take to understand their personal risk of developing hereditary cancers, and that some cancers are hereditary, and that's at hereditarycancer.com. And again, we just encourage people to take that next step for themselves, for their loved ones, for their colleagues, for their neighbors, so that we can get back to making steady progress in decreasing cancer deaths in the United States.
Harvey, give us a website where our listeners can learn more about Quest Diagnostics.
Yeah, the proper website is questdiagnostics.com, and there's information there for healthcare professionals, and there's information for consumers to read as well.
And that is Quest Diagnostics, all one word, .com, correct?
Yes.
Harvey, I appreciate you joining us here on Health Professional Radio and giving us a little bit of your time. Thank you so much, and hopefully we'll speak again.
Great. Have a great day.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Harvey Kaufman. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.